Hello and welcome. As I mentioned in episode 1, if you don't feel that your present doctor has your best interest at heart, change doctors. In this episode, I will describe my journey with a new doctor. A guy I worked with, after he retired, he was diagnosed with prostate cancer. He had the same experience that I had with his urologist, who was located in the same state that we both lived in, and he was looking to change doctors. Somehow, through word of mouth, he was told of a great urologist in a neighboring state, and he was accepting new patients. Now, he made an appointment and was completely satisfied with his treatment that he received. So, I got the urologist's number and made an appointment for me. My first meeting with the new urologist was very welcoming. He talked to me and not at me. He listened to what I had to tell about my treatments up until now. He accepted me as a new patient and immediately contacted the urologist I was seeing and asked for my records to be sent to his office. My wife and I returned home and waited for instructions from the new urologist. After going over my records, the new urologist sent a letter to me suggesting I call his office and schedule a biopsy. The biopsy was scheduled early in the morning, and because of the distance to the other state, my wife and I checked into a hotel that was conveniently attached by a skywalk way to the hospital where the biopsy was to be performed. In my hotel bathroom at 4 a.m. in the morning, I was on the floor using a suppository as instructed by the urologist to clean my bowels out for a clear view of my prostate. My wife and I left the hotel at 5:30 a.m. to check back in at the hospital. At 6:30 a.m., I changed into a hospital gown and was wheeled on a dolly into the operating room. Now, unlike the archaic procedure done in the doctor's office in my state, there I was put to sleep, and the urologist, using an optical scope to carefully guide a snipper, extracted 25 bits from a different location of my prostate to be analyzed for cancer. After the samples were taken, my wife and I returned home to wait for the results. I was a bit sore, seeing that this was my third biopsy. About a week later, I received a letter from the urologist stating that my Gleason score was 7+. Now, remember earlier during my talk, I said when I was officially diagnosed with prostate cancer. Well, when this letter came, that's when it was officially declared that I had prostate cancer. Now, I like to talk about what I found out what caused cancer in the prostate. According to medical journals that I read, doctors know that prostate cancer begins when cells in the prostate develop changes in their DNA. A cell's DNA contains the instructions that tells a cell what to do. When the changes tells a cell to grow and divide more rapidly than normal cells, the abnormal cells, cancerous cells, continue living while the other cells die. The accumulating abnormal cells can also form a tumor that grows inside the prostate. In time, in some cases, if the abnormal cancerous cells are not discovered in time, some of the abnormal cells can break away and spread to other parts of the body. That's called metastasize. For some reason not yet known, black men have a greater risk for prostate cancer than people of other races. Also, in black men, prostate cancer is more likely to be aggressive or advanced. And that's as far as I'm qualified to talk about the subject of how cancer begins in the prostate. Now, the Gleason score. The Gleason score, I also learned from reading various medical articles, is a system named for a pathologist who developed it in 1960. When a biopsy confirms the presence of cancer, the next step is to determine the level of aggressiveness of the cancer cells. A doctor in a laboratory takes samples of your cancer cells to determine how much they differ from the healthy cells and grades the differences using the Gleason scale. A high grade on the Gleason scale indicates a more aggressive cancer and that is more likely to spread quickly. Biopsy samples ranging from 6 to 10 on a Gleason scale are what urologists are really concerned with. A score of 6 indicates a low-grade prostate cancer. A score of 7 indicates a medium-grade prostate cancer. Scores of 8 to 10 indicate high-grade prostate cancers. So, you can see the Gleason scale gives the urologist a starting point on how to treat prostate cancer. So, now that I received a letter from the out-of-state urologist stating that I had a score of 7 indicating a medium-grade prostate cancer, what to do? This was the first major decision I had to make on my journey with prostate cancer. What I wasn't aware of at the time was that as I traveled further down the road on my journey with prostate cancer, there would be more critical choices to make that would affect my well-being, my quality of life. And I was about to be confronted with some of those choices. In the same letter that pointed out that I had the Gleason score, the urologist asked that I make an appointment with him to go over treatment options. At the time, as far as I knew about treatment options, there was surgery, remove the prostate, radiation, bombard the prostate with radiation beams, or implant radiation seeds and right into the prostate. Now, I knew from reading articles and the person that I worked with that people who choose surgery meant coming home after the surgery with a catheter in your penis that stays in about 3 to 4 weeks. That time is up to the surgeon. That allows the wound from removing the prostate to heal and keep the urethra open. When the prescribed time passes 3 to 4 weeks, and if the urologist thinks it's safe, he will remove the catheter, and if the patient can urinate without the catheter, the patient is sent home with instructions on how to use the Kegel exercise to strengthen the pelvic floor, which supports the bladder. This exercise is to help stop dribbling after and before urinating. So armed with what I knew about surgically removing the prostate, I made an appointment with the urologist. My wife and I met him to discuss treatment options. He explained my options from his standpoint as a surgeon, but if you remember early, I spoke about how picking a doctor as a team player. After my discussion with the urologist, he suggested that I also talk to the resident radiologist to go over my radiation treatment options. This is what I meant by a team player, having the best interest of the patient in mind. So the same day, my wife and I met with the urologist. We had a long talk with him. He was willing to answer any or all questions we had regarding radiation treatments. We spent a long day talking with the two medical specialists, after which we were anxious to get home. It was a long drive back to our state, and we had a lot to think about. We left with brochures about each treatment option. However, I was already leaning towards one, although I didn't tell my wife about it yet. Remember the first time the urologist catheterized me to remove the blood clot? Although the whole procedure only lasted about 10 minutes, there was something about a tube going up into my penis that seriously freaked me out. And though the thought of having one in me for 3 to 4 weeks, if it was the right decision or not to tolerate being catheterized, I'm not sure it was even today, I decided to go with radiation treatment. However, let me say this, whatever decision you make on your journey, don't Monday morning quarterback yourself. That's not helpful. Always look forward. I'll keep saying that. My wife and I returned to the out-of-state hospital to meet with the urologist and the radiologist. I thanked the urologist and informed him that I would be seeking radiation treatment. He wasn't too pleased, but he hid his disappointment well, and off we went to meet with the radiologist. He explained again what I should expect on my treatment sessions, what would be about 55 to 60 radiation treatments, one every day, 5 days a week. He also mentioned that a radiologist working in a hospital in my home state that he had trained. So I sought out that radiologist that he had recommended, and it turned out to be perfect for me. The treatments would take place in a hospital near me, and the new radiologist was a real team player. So, starting around 2002, I began external radiation treatments. Each morning after arriving at the hospital, I would go into the dressing room where I would remove my outer and underpants. All other garments would stay on. Around 11 weeks of treatments with little or no side effects, my PSA dropped to 0 after the end of the treatments. My family and I could not be more happier. Years rolled by and I was examined by the radiologist every 6 months. For the first 10 years, after the external radiation, the visits were casual and routine. Check my PSA and perform a digital rectal exam. But unfortunately, things started to turn around. The dreaded PSA number began to creep up in 2012. The radiologist ordered a bone scan on June of 2012 to see if my cancer has spread outside the prostate. Good news, it has not, but my PSA continued to rise. Though in the next year, in February, it was 4.2, 4.3, and by August that same year, it was 7.7. And by the end of the year, it was 10.3. So as we reached the 11th year as a team, the radiologist began to worry. My PSA was rising well out of the normal range. At this point, he suggested that it was time for me to see a urologist again. I had grown comfortable working with him, but sadly it was time to move on. So after all these years, I was right back to seeing a urologist again. What happened? Did I choose the right treatment at the start? This was one of those moments, like I said before, don't Monday morning quarterback yourself. It's not helpful. Always look forward. So the radiologist and I parted for the last time, and off I went to visit a urologist. On the next episode, I will talk about my journey with the new urologist.